Hi everyone, welcome to POC Nurse. In this video, by the way, my name is Gozi, and in this video, I want to talk about income generation through home health nursing. So, if you haven't been to this channel before, listening to any of my other videos, I've worked home health care and I've also worked in the hospital. So, in the hospital, for the most part, as far as I know in my experience, you are paid by the hour. You're paid by the hour, and anytime you work over 40 hours, you get paid overtime. Now, you can pick up extra hours when you work in the hospital, or you can work two jobs. When you work in the hospital, you can work two hospital jobs, get paid by the hour at both, and maybe pick up overtime at both. There's only 7 days in the week, and you might be working 6 days, so you might pick up overtime in one or the other. Also, in the hospital, you can get a per diem job, which is also paid by the hour, but you don't have to work the full 36 or 40 hours that's required. When I worked per diem, I was required to work two shifts a month. That is, I work 12 hours a day, so that is 24 hours in a month in a schedule. So that's how you get paid in the hospital. In as a nurse, working as a nurse, like providing patient care, if you're in administration, is different. You're most likely salaried, but as a nurse, you're paid by the hour. Now, when you go over to home health care, so when I went for my interview, I didn't really think about how was I going to get paid. I just assumed I was going to get paid by the hour. But when I got there to the interview, and the interview was going on, and we got to the matter of income and payment, the interviewer told me that they did not pay by the hour. They paid a salary to their nurses. But later, in that same agency, I found out they paid some people um, a salary and some other people by the visit. Oh, I forgot to add that to my to this video. They pay by the visit, right? So the way you are paid in the hospital and the way you are paid in home health care could be different. Could be different. So, do nurses make more money in home health care? The answer is it depends. It depends. So, if you're talking about you work strictly 40 hours a week and you're paid $120,000 a year, you are probably making more money than the nurse that works maybe 36 hours in the hospital or just 40 hours in the hospital. But then you have to look at how many hours are you actually working for the money that you were getting paid, right? So if you're a home health nurse and you get paid $120,000 a year for 40 hours, and you are working 60, 70 hours a week. I don't know if you're making more than the hospital nurse that when she works 60, 70 hours a week, she gets paid for every single one of those hours. You have to kind of do apples to apples, not apples to oranges. So, and I say all of these from experience. When I worked in home care, I worked 60 to 70 hours a week. It was documented. I could see it on my tablet thing, so it's not just me saying it. And sometimes I work longer because if you spend too many hours on a visit, you get a call and someone would ask you, are these the actual hours you spent on that visit? Sometimes even if I spent like 5 hours just to not seem problematic, I'd say, oh no, it was 3 hours, you know. So your hours might go beyond the actual hours you are contracted for, being paid for, the 40 hours. So then are you really making more money in that sense? But if you're strictly working your 40 hours for that 120K a year, you're making some good money. And you could also pick up hours in the hospital if you wanted to make extra money. Or there are some other ways you can also make money while you're doing home health care in the same agency. And I'm going to jump into that now. So let's talk about how are home health nurses paid. So, like I said before, you could get paid by the hour, you could get paid a salary, you could get paid on a per diem basis if it's a per diem job for you, and you could get paid for picking up visits on the weekends and for taking up on call, providing on call services to the agency. I'm going to take each of this one by one. So let's talk about hourly pay in home healthcare. So it's pretty self-explanatory. So if you work by the hour in the home healthcare field, getting paid the same way as if you worked in the hospital. You get paid by the hour. You work your 8 hours, you work 10 hours, 12 hours for the day. They pay you. Home healthcare to me is very involved. You work long hours. So if you're getting paid by the hour, I think it's the best way to go about it because every single hour you put in is paid for. And, I would feel more satisfied, content if I know, okay, all of these hours I'm putting in, I'm getting paid for it. Maybe I can plan a vacation at some point with my family to kind of make up for those hours that I missed spending with them. I could tell myself, okay, in a month or two, I'm going to take 2 weeks off, 3 weeks off, and it's going to be like a focused, intentional time that I spend with my family making memories. So in this sense, home health care would be great if you're getting paid by the hour. Now, as far as I know, they don't have unions. As far as I know, because each home health care agency is run the way the owner wants to run it, right? So you would have to negotiate your own pay. There's no union to negotiate for you. So they might offer you something high, something low. It's up to you to do your research, ask your friends how much they're getting paid so that you can make sure you're getting fairly compensated for the work that you will be putting in. Next, I want to talk about salaries in home health nursing. So, like in a previous video, I talked about the salary I was offered when I was in home health care. It was a good salary. If I was putting in 40 hours of work, it would have been perfect. But I was working 60 to 70 hours a week. Not only that, my kind of family life was suffering because I was always working. So, in home healthcare, you could be paid a salary. This is not hourly and there is no overtime. So if you work 41 hours, you're paid for 40 hours. And if you work 25 hours, you're paid for 40 hours a week. But the likelihood that you'll be working less than 40 hours a week is pretty rare. Um, but it could happen, you know. So maybe you could use that fact to offset the days that you are really busy. But bottom line is, if you're a salaried nurse in home health nursing, you are not paid any overtime for any hours worked over 40 hours during the work week. That is Monday through Friday, whatever time your work hours are. If you're working 9 to 5, you work 9 to 10, you're only paid 9 to 5 for that day, or a total of 40 hours for the week. So, this is another way nurses are paid in home health care is via a salary with no overtime. Talking about per diem pay in home health care, it's not quite per diem because in the hospital, when you work per diem, you get paid by the hour still. In home health care, in my experience, I don't know about other people and other places where I worked, you get paid by the visit. And the amount of money you're offered per visit might not be the same another nurse in same agency is making per visit, right? So that's just something to keep in the back of your mind. So now you are paid by the visit. And not only are you paid by the visits, different visits have different price points. What you get paid for a regular visit is not what you get paid for an admission. Also, I forgot to mention in home health care, you get reimbursed in some agency, you get reimbursed for the mileage you put on your car when you're driving from patient to patient. You don't get paid when you drive from your house to the first patient, but you get paid for mileage from the first patient to the next patient. Now, if you drive from your house to the office of the agency, you don't get paid. But if you drive from the agency to the first patient, you get paid for mileage. Just wanted to throw that out there, and then I'm going to continue with the per diem pay in home health nursing. So the per diem pay is actually a per visit pay. So what you get paid for regular visits is different from what you get paid for admissions. There's a couple of other different pays that I don't remember, because when I left my home healthcare job, I was offered a per diem position and I was given the pay for the different visits, you know, but based on my experience of the hours that I put in as a regular salaried nurse, I just knew that that per diem pay wasn't going to work for me. Because I calculated, okay, I think the regular visits were offered at $55 for the visit. So I calculated, um, if I drive 30 minutes and I was told I could pick the area where I wanted to work, so it would offer more flexibility. So maybe I would have patients where I only have to drive a couple minutes to go see, and I'll see the patient and move on to the next patient. But I know this agency has patients all over the place, and I know kind of where they have enough nurses and where they need nurses. And if I'm depending on this job for extra income and they don't have patients in the place where I would want to work, then I'd have to go further out, right? If I really needed that money. And so I calculated, if one visit is $55 for the visit, not $55 an hour, I have to drive there. I have to put miles on my car. I have to put gas in my car. I have to drive there, spend some time there, and then move on to the next patient, right? So there's no guarantee that once I hop in my car, there will be no traffic to me getting there. There will definitely be wear and tear on my car. I will definitely burn gas. I might get there and not find parking, circle around looking for parking and killing time. I might find parking, see the patient, come out, and then I have a ticket of maybe 65 bucks. That $55 is gone. And if I spend over an hour on that visit, it is no longer a $55 an hour visit. If that's kind of what I'm calculating, that if I work 8 hours, it's going to be $55 an hour. It's anyway, that is how I did the math in my head. And I said to myself, you know what? If I take a per diem job in the hospital for $55 an hour, I'm gonna drive my car there, get to work for my 8 hours, and at the end of the day I'll get paid 8 hours. And if I work over 8 hours, let's say I work 10 hours, I had to stay to help or do documentation, I work 10 hours, I get paid $55 an hour for 10 hours. So it didn't seem like a good fit for me. So I did not take the per diem position. But if you're thinking of how can I make money if I'm in home health care, this is one way, taking a per diem position in home health care. Now, if the area where you're working is around your house, it would be awesome because you could go boom, 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 see all your patients, probably make that $55 per visit, like in less than an hour per patient, and you'd be done and you'd be home. If it works for you that way, it will be super awesome. So, this is another way to make money in home health care, um, is getting paid per visit in a per diem manner, if that makes sense. All right. So the next way you can make money in home healthcare. Now, if you are fast with the documentation and all your patients are close together, maybe in your neighborhood, maybe even in another neighborhood, you can make good extra money in home healthcare by picking up shifts on the weekends. So if it's a really busy home health care agency, they could have weekend visits, and those weekend visits are paid like the per diem. So like they pay you for your Monday through Friday 40 hours, and then if you pick up shifts on the weekend, it'll be extra money that they pay you. It's not overtime. Usually, anyway, in my experience where I worked, it wasn't overtime. You got paid by the visit. So and the rates for those weekend visits are kind of like the per diem rates for the per diem nurses in a way, I think. So if you do an admission, it's more pay than if you did a regular visit. So if you pick up admissions on the weekend, maybe 4 admissions, you could make a good amount of money. The pay could be up to $200 per visit. And also, if you're fast with the admission, if you can get the admission visit done in under an hour for $200, that is good on you. That's good money. So on the weekends you get paid by the visit. So if you see patients on Saturday, you see patients on Sunday, all of that money is extra money that you make. You can also pick up on call shifts. Now the on call shifts, so the home health agencies are open 24/7. It's always open. So anytime the patient calls, someone will pick up the phone, and if they need a nurse, the patient will be connected to a nurse. So the on-call is kind of twofold. You pick up the phones, evaluate, see what's going on with the patient, and then you determine if you need to go see the patient, if the patient needs to go to the ER, stuff like that. So this is also paid separately from your 40-hour pay. And for the most part, you might not have to go anywhere. You might just have to talk to the patient on the phone, talk them through something, and hopefully you don't have to go out in the middle of the night to see the patient. I never did on call when I worked home health care, but I know one of the other nurses did it routinely. So that's another way you can make money in home healthcare, is by picking up these extra shifts that are paid separately from your base salary or base pay. You'd make extra money that way. Okay, so this is where we come to the end of this video. I hope someone out there finds it helpful. Please like, share, and subscribe. I don't say that enough in my videos. And I will see you in the next video. Bye bye now.